Hey, good morning, everyone. I'm making this video for high school friend Iroro. He's a great guy, great doctor, selfless, family man. He has his wife and four kids. He's a professor at the University of Port Harcourt, and he's recently gotten an admission into LSU in Baton Rouge. So he's going to be able to get his PhD and more emphasis and focus on the pediatric side, cancer for kids and babies, and HIV. But I will try and attach things to this video so that you guys can get a better glimpse of who Iro is. He's a very great guy. If I could, I would, donate all the money I can. But I'm creating a GoFund account for Iroro so that he can get through the fees for his LSU PhD and also room and board and things like that. So I'm going to pause the video now and I'm going to share a few things about Iroro that I think will be more insightful. Thank you. All right, so actually trying to share more about him, I'm using the aid of it's a notebook LM. It's a Google feature, really nice, and I would play two clips, which kind of summarizes what he's done so far. So this is the first one. Um,
Welcome to the deep dive.
Great to be here.
Today we're taking a closer look at the career of Dr. Iroro Yarhir. She's a pediatric endocrinologist and also a medical educator based in Nigeria.
That's right. And our main source material is
correction, it's a he, not a she.
per CV,
So yeah,
which is really quite detailed. Gives us a great roadmap.
Exactly. And the aim really is to go beyond just, listing accomplishments. We want to understand the journey, her expertise, the impact she's made in child health, in medical education, basically give you a condensed insight into what looks like a really remarkable career.
Absolutely.
So looking at that CV, what jumps out at you first?
Well, straight away, it's the sheer breadth of her training. You see Nigeria, obviously, but then also Kenya and Israel. That kind of international exposure, especially early on, to different healthcare systems, different ways of doing things, that must give such a rich perspective.
You'd think so, yeah. Especially bringing that back to Nigeria.
Definitely. And then there's just the volume and the variety of her publications and all the different leadership hats she's worn. It paints a picture of someone really deeply committed.
Okay, so let's dig into that education piece first. The CV traces it right from junior school through her medical degree, the MBBS, and then a master's in medical education, both at the University of Port Harcourt.
Right.
But those international training stints you mentioned, they really stand out. What's the significance there, do you think?
Oh, hugely significant. That pediatric endocrinology training in Nairobi, the PET-SECOP program under ESPE.
ESPE being the European Society for Pediatric Endocrinology.
Exactly. And then the clinical fellowship in Israel at Safra Children's Hospital. These aren't just, short courses. They represent a serious, dedicated pursuit of highly specialized knowledge in her field.
So actively seeking out international standard training.
Precisely. Training that maybe wasn't fully available or available to that level within one location.
Yeah.
It shows real initiative.
And after that, she got her fellowships, FWACP in pediatrics.
That's the West African College of Physicians.
Right. And the fellowship of ESPE itself, that feels like a major validation of her expertise.
It really is. Those fellowships, they're tough. They mean rigorous training, passing demanding exams. It's recognition by your peers, regionally and internationally.
So it cements her standing.
Absolutely.
Yeah.
As an expert in general, pediatrics and the endocrinology specialty. And, it's interesting. Looking at her dissertation topics, even back then.
Oh, yeah. What were they?
One was on the pediatric endocrine curriculum itself, and another looked at serum zinc levels in children with HIV.
Ah, so we see those twin interests early on, clinical research and medical education.
Exactly. Kind of foreshadowing her later career path.
Okay, so building on that strong foundation, let's look at her jobs, her appointments. There's a clear progression, isn't there? Lecturer up to senior lecturer at the University of Port Harcourt.
Yep, a steady climb.
And she's also been a consultant pediatrician at the teaching hospital there since what, 2012? That ongoing clinical work seems important.
Oh, it's crucial. It means her teaching, her academic work, it's all grounded in the reality of actually treating patients day in, day out.
She's not just in an ivory tower.
Not at all. And look at the leadership roles alongside that. Coordinating practicals, co-coordinating the MSc in medical education, heading the ER unit at one point, co-heading the endocrinology unit.
Even chief resident earlier on.
Right. It shows this growing capacity for leadership, taking on responsibility for how things run, not just her own practice. She's invested in the whole system.
And that investment clearly extends to teaching the next generation. Her CV lists extensive teaching duties. Undergraduates, postgraduates.
Yeah, lectures, ward rounds, the whole spectrum. And specific undergrad topics too, like growth, thyroid issues, fever, clinical reasoning, core stuff.
Plus supervising master's and PhD research.
And what really stands out for me, tying back to her own education, is that master's in medical education and her dissertation on the endocrine curriculum.
Right, she's not just doing the teaching, she's studying how to teach effectively.
Exactly. It's a meta-level interest. Her papers on curriculum uniformity, the faculty workshop she ran on assessment quality. It all points to someone actively trying to improve medical training standards.
A real focus on the how.
Definitely. Makes you wonder how that's actually shaped pediatric endocrinology training there.
And she seems adaptable too. There's a publication about using Google Classroom during the pandemic.
Yeah, it shows she's responsive, willing to explore new tools, which became, well, essential recently.
Sure.
And there's more. Co-authored papers on medical ethics, on altruism in medicine. It shows she's thinking about the broader aspects of professionalism, the values, not just the hard science.
It's a very holistic view of medicine and medical training.
It seems so.
Okay, let's shift gears slightly to her research output. It's substantial. Books, chapters, tons of journal articles.
A really significant body of work.
Can you see clear themes running through it?
Oh, absolutely. There's a very strong, consistent focus on pediatric endocrinology. See diabetes, thyroid stuff, growth disorders, ambiguous genitalia, congenital hyperinsulinism, her core specialty.
Makes sense.
But importantly, it's not only that, she's also tackling broader child health issues really relevant to the Nigerian context. Things like pediatric mortality patterns, malaria, newborn screening.
So specialist focus, but also addressing wider local health needs.
Exactly. It suggests she's deeply embedded in both her specific field and the overall health challenges faced by children in that region. You have to wonder how those two streams of research feed into each other.
And her research isn't just local, is it? You mentioned international collaboration.
That's right. Articles in journals like Acta Biomedica with European co-authors, and crucially, her contribution to the ISPAD Clinical Practice Consensus Guidelines.
ISPAD being the International Society for Pediatric and Adolescent Diabetes.
Correct. And contributing to their guidelines on glucose monitoring. That's significant international recognition.
What's the impact of that kind of collaboration?
It's huge. It means her expertise is valued globally. It facilitates knowledge exchange, sharing best practices, maybe even resources. It can really elevate the work being done locally.
And she's involved in peer review, too, for Nigerian journals.
Yes, reviewing and editing for several, which again shows that commitment to maintaining academic quality and sharing knowledge within her own national medical community.
So beyond the clinic and the classroom, there's this whole layer of service and advocacy. She's involved in a lot of professional groups.
A lot. Nationally, like the Pediatric Association of Nigeria, where she's held roles, and internationally, SPE, SBE, SIN, PSS.
Wow.
It shows a real commitment to the field at all levels. And, her CV explicitly states an interest in listening and advocacy for child health.
That's quite direct.
It is. It's powerful. It says her dedication goes beyond just the medical issues to the child's overall well-being and voice. Makes you think about the kind of impact that advocacy can have on policy, on practice.
Definitely. And there's even community service mention, research on safer transit communities, sponsored by a company, Dangote Cement. That seems broader than just medicine.
It really does. It shows an understanding that health isn't just about hospitals and clinics. It's about the environment, social factors.
The bigger picture.
Exactly. Engaging with community issues, working with non-medical partners. It demonstrates a very holistic public health perspective.
And finally, the awards and recognition. Best graduating student for her master's, boards from the Pediatric Association, the teaching hospital, those ESPE clinical fellowships.
Plus scholarships way back as an undergrad.
Right. Mobile and Shell.
It all paints a picture, doesn't it? These aren't just random accolades. They mark consistent high achievement, dedication, and the respect she's earned from peers and institutions throughout her career, from early promise to sustained excellence.
So putting it all together, Dr. Yarhir's career really is this powerful blend. Deep commitment to pediatric health, especially endocrinology, combined with this serious dedication to medical education and research, all within the Nigerian context, but with international engagement too.
Yeah, it's a journey of continuous learning, taking on more leadership, and just a clear drive to improve things both the care patients receive and how future doctors are trained.
It's quite inspiring, actually.
It really is. This deep dive into just her CV shows this incredible pursuit of knowledge, a commitment to mentoring, and a real dedication to children's health, which I guess leads to a final thought.
Go on.
Well, considering everything she does, the breadth of it, what do you think are the biggest challenges, but also maybe the biggest opportunities for pushing for pediatric endocrinology and medical education in places like Nigeria in resource-limited settings?
That's a big question.
It is. It makes you really think about the complexities of global health and just how vital people like Dr. Yarhir are in navigating those challenges.
All right, thank you. Actually, listening to Iroro Yahari's CV, in a podcast context, just the amazing breadth of what he's done and what he'll continue to do with the help of our Savior Jesus Christ. He'll be able to excel. Any donation, is not never too small. The way I look at it, if we get 7 people, that have 10 friends, that's 700. And even if it's $10 each, that gets us closer. Or, $1. And then if you donate $1, just invite 10 more people to donate another dollar. And before you know it, we'll get to the goal of helping someone that is out there helping others. Be very selfless. Thank you. And I hope everybody can help contribute to support Dr. Iroro. Yeah, Harry. Thank you. Bye-bye.